So for diabetic eye disease, the standard therapy nowadays is anti-PIGF treatment, but about 40% of patients do not or suboptimally respond to anti-PIGFs. So we have three new molecules in the clinic. One of them is placental growth factor, that is of the VEGF family. And there, in a first study, we have found some very interesting results. That like up to 30% of patients had their BCVA improved with 3 lines. And that was at day 90, so 30 days after last injection. And even at day 150, which is like 90 days after last injection, a subset still had an improved visual acuity. Second molecule is a plasma kallikrein inhibitor. That's a strong anti-edema product. It's now in phase 1. And then the third molecule is an integrin inhibitor. Also a strong molecule, possibly an alternative to anti-VEGFs, and also in the clinic. Well, in that study we had a group of what they call treatment-naive patients that had not been treated before with anti-VEGFs, and treatment-resistant. On the treatment-resistant side, we had some patients that responded quite well, but we are still analyzing patient by patient why the patient responded or not, and see whether we can find elements to predict what could be a potential responder or not. Into ophthalmology, I've been active in diabetes for like 20 years that I've been working in the diabetes field, and we're working in ophthalmology, and so the medical need in diabetic eye disease is huge. I diagnosed my own son with type 1 diabetes, and I do know that if you ask people with diabetes their biggest concern, it's not about losing a toe or a foot, it is losing the eyesight. So we as a company are very committed to make sure that we bring drugs with good value for the patient to the market.